This Show You Care special, AIDS in Iowa, is brought to you by Alliant Energy, Hardee's, St. Luke's Hospital, and United States Cellular.
Hello, I'm TV9's Renee Chu. World AIDS Day is celebrated every year at the beginning of December. It's a time to remember the ones we've lost, care for the ones who are living with AIDS, and educate people about how to protect themselves from the disease. According to the Centers for Disease Control and Prevention, reported AIDS cases in Iowa have dropped since 1997. But that doesn't mean any of us are safe. It doesn't matter if you're female or male, young or old, straight or gay. Anyone can become infected with HIV. The only way to protect ourselves is through awareness, compassion, and education. And that's what we're going to do here in the next 30 minutes. You're about to see how AIDS affects Eastern Iowans, their families, and their lives. We'll show you how community resources and support are helping people who have AIDS. You'll see how high school students continue the fight against AIDS in the classroom. And we'll take you to the University of Iowa hospitals and clinics where new AIDS drugs are being tested. Almost 900 people in Iowa are HIV positive or have AIDS. They could be your family member, your friend, your neighbor. What is it like to live with this terminal disease that has no cure? We introduce you to Joe Wilson of Iowa City.
I started getting involved with HIV, AIDS, and related issues in 1987.
For more than a third of his life, 36-year-old Joe Wilson of Iowa City has talked to young people about safe sex and preventing HIV. But during one sexual encounter in 1997, Joe didn't practice what he preached. He later tested HIV positive.
I wasn't really upset, oddly enough. I just remember thinking at the time, okay, life's tough. Here's another thing I have to deal with. And I'll deal with it.
Joe deals with the disease by trying to lead a healthy lifestyle. That includes making sure he takes his pills 4 times a day, every day. They keep him alive, but they also keep him from forgetting the physical toll of HIV.
My day-to-day health has changed actually a great deal since I started the medications because of the side effects, some of which are rather unpleasant.
And what may be relatively surprising is the lack of prejudice Joe has faced since telling people about his HIV status.
I'm surrounded by supportive people, both socially and at work, and even on a casual basis. But that's not true for everybody. Not everybody has the benefit of that kind of environment, and some people do face discrimination.
The thing about AIDS is that it doesn't discriminate. Joe is gay and contracted the disease from another man. Kat Simon of Cedar Rapids is straight and is also HIV positive. She doesn't know exactly when she contracted the virus, but she does know this.
Growing up in the Midwest, because I was born and raised around here, you feel safe. You feel like it's not going to happen to you, but that's not the case. It can happen to anybody.
I mean, I took a few months, about 6 months, before I went public with it.
It's a message Joe emphasizes when he does talks as an HIV/AIDS outreach counselor. Each time he works to shatter the myth of AIDS as a gay man's disease.
And while a lot of people associate HIV with that segment of the population, it's important to note that actually the fastest rising group or part of our society that is contracting HIV are young people ages 14 to 25 who self-identify as heterosexual.
And Joe can identify with the fact that having a disease that could end your life does change your life.
Even if you go about your life the same way, you still feel different because you've gone from living your life with mortality as just a concept, an abstract concept, to really something that's more of a concrete reality for you, your own mortality, once you realize you have a terminal virus.
As you just saw, Joe doesn't look sick, and that's because people infected with HIV usually look and feel healthy for years. Some may not even know they're infected, but they can still spread the disease through unprotected sex and blood-to-blood contact. The complications of HIV and AIDS affect more than its victims. Family and friends say their lives will never be the same after watching a loved one suffer. In a moment, we'll bring you a story you may never forget. A mother and father tell their tale of loss, longing, and love.
It's not pretty. Not pretty.
It was heartbreaking to watch someone that age slowly waste away.
Joanne and Ron Bronsema lost their son to AIDS. He was only 30 years old. His family is still coping with the loss. Donald Andrew Bronsema was born in July 1967, but he died from the complications of AIDS just 3 years ago, 2 months shy of his 31st birthday. When he was diagnosed, his parents didn't know anything about the disease. Now they speak to others about AIDS and its dangers. Joanne and Ron want others to learn from their son's life.
And this was his Cub Scout things. This was his Boy Scout things. This was
Joanne Bronsema created this quilt block to honor her son.
And his ashes were scattered, so he has no monument, no gravestone, no plaque on a wall, no urn of ashes, which is why I made the quilt panel. To me, that is his monument.
The quilt block is now part of the AIDS Memorial Quilt. Every year it's displayed in Washington, D.C. Joanne and her husband, Ron, learned their son had AIDS the same day they learned he was gay. It's a moment they will never forget.
He said, we've got to have a talk. And it's something I've got to tell you. And at that time, he says, I have AIDS. He said, he didn't know how to tell it. I mean, just, you say it. And that's what he was up against, and finally he said it.
And I just, I immediately went over and hugged him, and we both hugged and cried, and I said, just let us know what we can do.
Don Bronsema was finishing his residency in pediatrics in 1995, the year he was diagnosed. 2 years later, he was fighting all the complications that come with AIDS.
It was a real shock to us. We knew there was something wrong with one leg or one foot, and he had told us about a year before that he said, I've got a little Arthur in my hip. But actually he had Kaposi's sarcoma, and it had literally eaten a hole in the sole of his foot.
And during that period of time also, we noticed when he was around sometimes, there was an odor. And he explained that away by saying, oh, I forgot to brush my teeth, I didn't change my socks, and but it wasn't that. It was one of the opportunistic diseases that come in with HIV. The HIV lowers the resistance a person has to these diseases, hits their immune system. As I understand it, HIV never killed anybody, but it opens the way for these other diseases which can.
After assessing all of his symptoms, Don was suffering from at least 12 different diseases.
And he suffered very much. And it's not a pretty thing to see. The worst of it probably is, you're so doggone helpless. Here's your child. Regardless of how old they are, they're still your child. And any parent will know what I'm talking about there. But, there's nothing we could do.
Don passed away on May 5th, 1997. His body was cremated, and his ashes were spread on the family's flower gardens and on the island of Jamaica, his favorite vacation spot. Joanne and Ron say they're trying to turn their son's death into a positive by sharing their experience with others.
I hugged and kissed Don all the time, and we ate his food. We weren't afraid to eat his food. So, some people just are ignorant about it. They don't know how it's spread and how it works, and that's kind of sad. So we kind of seek to dispel that ignorance, and it makes us feel better.
The two volunteer for the Rapids AIDS Project in Cedar Rapids. They talk to teens and adults about AIDS, how it spreads, and how it changed their lives.
And like I say, I still get pretty emotional. I still cry. Maybe I always will. Maybe that's good. I haven't forgotten him. And he was part of our family for a good number of years, so I don't really want to forget him. This whole thing has thrown life out of perspective, really. Your children are supposed to bury you. You're not supposed to bury your children.
The Bronsemas hope their story teaches Iowans that AIDS can strike anywhere, geographically and demographically. Everyone is at risk. Living with AIDS is challenging physically, mentally, and financially. Where do you go when you can't make it on your own? The Clare House in Cedar Rapids is the only facility of its kind in Iowa. You'll see how this house eases the high cost of living with AIDS after this.
Also being around people that have the same type of problems that you do. It is a lot of support.
This Cedar Rapids woman living with AIDS had no place to go until she found her place at Clare House. When you're living with HIV or AIDS, your health comes first. Most of your money goes towards medicine. That means not much is left for other needs like food and shelter. But Clare House in Cedar Rapids is a place where you don't have to sacrifice health for housing. Since 1996, it's provided an independent living community for those with the disease, and it's the only facility of its kind in the state. On the outside, Clare House on Washington Avenue puts up physical barriers to winter's waves.
There's section that place off upstairs for like game rooms.
On the inside, it breaks down barriers for people living with HIV and AIDS.
It's a shelter, it's a protection, and it's a service that we're providing.
Providing affordable housing for people like Kat Simon. She was diagnosed with AIDS earlier this year. Her family couldn't take her in, and her income couldn't take the cost of living on her own.
My disability is like $600 a month. So if I have to pay out more rent, then that's just that much more money I don't have to live on.
Part of her rent is paid through RAP, the Rapids AIDS Project with the American Red Cross. Clare House also provides food, even transportation to University of Iowa hospitals and clinics. It's also a meeting place for weekly dinners and support groups.
There's our list so far of just the donors just for the house.
Clare House has received a tremendous amount of support from the community. Generous donors helped purchase what's become Clare House's new home since November. With these letters, they're asking further help to renovate and expand Clare House from 4 bedrooms to 6.
And it's going to take them a long time to get any size.
As for Kat, her bedroom gives her the privacy she needs. And whenever she needs support, she says she can find it from the others who live here.
We kind of watch out for each other. If we notice that somebody's getting sick and they're not paying attention to it, we can say something.
Clare House is not a hospice. It does not provide any kind of medical care. But the kind of care it does provide, independent living, can do wonders for their health.
The health of the person is affected greatly by stress. And if they're here where there's less stress because of financial problems, that's certainly going to improve their health quality.
Along with private donations, Clare House also received a $17,500 grant from the Hall Perrine Foundation. The money will help pay for electrical upgrades, handrail installation, and smoke detectors. Clare House Director Jim Foxwell says the need for a respectful living environment for people with AIDS is growing. There are already 2 others waiting to move into Clare House. Well, so far you've seen how Eastern Iowans live with AIDS, how families cope with the disease, and the help available to AIDS victims. Now let's look into the future. How can we stop the spread of AIDS? Volunteers for the Rapids AIDS Project in Cedar Rapids believe education is the best weapon in the war on AIDS. Their team of peer educators tackled the toughest issues with students. Lindsay Voss is a senior at Cedar Rapids Washington High School. She's also a volunteer for the Rapids AIDS Project. Lindsay talks to middle school students about AIDS.
The people who have the highest rate of infection are actually heterosexual women from ages 15 to 24. And 15 to 24 is important because you guys are all progressing to that age very soon. It feels great to be able to know that you're reaching, middle school age kids who it's definitely going to affect in the future.
Lindsay and 11 other high school and college students in Lynn County volunteer for the Teens Educating the Community program. They're trained by professionals from the Rapids AIDS Project and the American Red Cross. HIV/AIDS Program Director Tricia Kitzman believes the best way to teach students is by using student teachers.
With youth, they like to talk to other youth. They like to look across the table and see someone who is approximately their same age, someone who is young and energetic like them. And so we have a peer educator program to help educate the peers. So it's a one-on-one conversation about HIV and AIDS.
Peer educators tackle some touchy issues in their speeches about AIDS, but training makes them strong sources of information.
After they've gone through the facts practice training, we have a training session where we stand up in front of the group and each of us say body parts, and we talk about sex, and we get pretty graphic, but it's so they're not embarrassed. And then also, because if they sound confident and look confident when they're discussing these sensitive issues, then the peers are going to be more likely to want to talk about it.
And all that talking leads to more educated kids.
Education is very important. It's not just a youth problem, it's not just a middle-aged problem, it's a problem for all generations.
Thanks to Lindsay's generation, AIDS education will continue.
Number one thing is that it's completely preventable. Completely preventable. They all have the ability and have the power to keep themselves safe.
To learn more about how you can help AIDS victims and their families, contact the Rapids AIDS Project at 319-393-9579. That's 319-393-9579. Or if you're looking for a program closer to you, stay with us. We'll have a complete list of HIV and AIDS-related agencies at the end of this program. The battle against AIDS doesn't end in the classroom. It continues in the laboratory at the University of Iowa hospitals and clinics. This lab is testing an AIDS vaccine. You'll meet the doctor researching the latest AIDS drugs coming up on this Show You Care special.
But what you're trying to do is slow the progression of the disease. And we think that you can do that effectively for potentially decades.
This University of Iowa AIDS specialist says AIDS patients today could live a normal lifespan thanks to new drugs. 10 to 15 years ago, being diagnosed with AIDS was an automatic death sentence. Not anymore. Researchers are constantly developing new drugs to fight the disease and extend patients' lives. The University of Iowa is at the forefront of that research. It's part of the AIDS Clinical Trials Group, which is a network of research sites funded through the National Institutes of Health. The drugs they test help extend Eastern Iowa lives. If research is the blood of medicine, one primary vein starts here at the University of Iowa AIDS Clinic. Since 1988, its purpose has been this:
to centralize the medical care and to provide an interdisciplinary team approach to caring for HIV patients.
The interdisciplinary approach means in addition to caring for patients, doctors also conduct research. Everything from understanding more about how the HIV virus works to which drugs can effectively attack the virus.
What you're doing when you're treating HIV is very specifically stopping the virus from multiplying. Now that doesn't get rid of the virus in them because the virus has an intermediate latent stage that the drugs don't get rid of.
In that sense, doctors compare AIDS to other chronic illnesses like diabetes and heart disease. With drugs, AIDS has become a disease you can manage. There are about 15 drugs currently licensed to treat HIV. Problem is, their effectiveness on a patient can wear out. That's because the virus mutates and makes itself resistant to certain drugs. So researchers are always trying to develop new drugs to combat those mutant viruses in what's called clinical research.
There are people volunteering to take experimental treatments to see if they are as good or better than standard care.
UIHC has participated somewhere between 15 to 20 trials in the past 6 years. 5 of the drugs they tested have been licensed.
Okay, looks like you had some headaches.
And now doctors are testing an HIV vaccine on 5 patients. It can't prevent someone from becoming infected. The vaccine only helps someone already infected fight the infection better. But as far as developing a vaccine for those who don't have HIV, doctors say that will be difficult.
It'd be like trying to come up with a cold vaccine. You could make one that would work against one strain, but there are 110 more strains that you're going to miss.
It's important to point out that none of those medicines can prevent you from getting HIV, and none of those treatments can cure AIDS. Dr. Stapleton says it's highly unlikely that we'll see a cure in our lifetime. Well, that wraps up this AIDS in Iowa special. We hope you've learned the disease itself is only part of the picture. Through family support, assisted living, educational programs, and the latest research, Iowa is fighting the spread of AIDS. If you'd like to join in on that fight, grab a pencil and some paper. We have a list of resources you can turn to for answers, support, or for a volunteering opportunity. I'm Renee Chu. Thank you for watching.
This Show You Care special, AIDS in Iowa, has been brought to you by Alliant Energy, Hardee's, St. Luke's Hospital, and United States Cellular.